President Donald Trump says more tariffs are coming.
That includes one on pharmaceuticals, where the rate could be as high as 200%.
For the people that live in this community and need these pharmacies to get their medication, now we got to come in and we're slowing their process down. It's messed up.
With just a single tweet, a decision, and now millions of people may face skyrocketing drug prices or find noise near their homes anymore, not because of a crisis, but because of a global tariff game. Recently, the US president announced that he is considering imposing a 200% tax on all imported pharmaceuticals if they are not produced in the US. A deadline has been set August 1st, and if no concessions are made, every country, even close allies like Canada or Australia, will have to pay the price. But instead of stepping back, each country chose a very different way to respond. One side openly confronts, one side is quietly building a defensive line, and there are places quietly reassessing their entire relationship with the US. Could a tax policy inadvertently turn medicine, a symbol of life, into a political bargaining chip? And if the allies start to resist, who is really being isolated? A small note for you is that the video content is compiled from various public report sources and does not aim to attack any government or individual. We strive to provide an objective and in-depth perspective for viewers to evaluate on their own. And to begin, let's turn to Australia, a country that did not choose the path of silence, but boldly declared, "We will not trade the basic rights of our people just to appease US policies." Once again, the White House has left the trade world in turmoil with the announcement, new taxes are coming. In the latest statement, Mr. Trump asserted, if trade agreements are not signed before August 1st, the countries involved will face extremely strict tariffs. Accordingly, more than a dozen world leaders have received warning letters from the White House. Among the major trading partners, Japan and South Korea will face a 25% tax, South Africa 30%, while Myanmar and Laos could be subjected to a tax of up to 40%. Notably, the tax rate on the pharmaceutical industry could reach 200%. With pharmaceuticals and semiconductors, those studies are being completed at the end of the month, and so the president will then set his policies. Then, when the announcement of the 200% tariff from the US reached Canberra, many expressed their concerns, not only because that figure is too large, but because it hits one of their most sensitive export sectors, pharmaceuticals worth over $2 billion each year. But in the end, why is the pharmaceutical industry so important? The US market is really important to pharmaceutical manufacturers because it is the largest market in the world. For a long time, the US has been the largest pharmaceutical market in the world, and specifically for Australia. 40% of exported pharmaceuticals are sent to the US, bringing in over $2 billion each year. The largest company in this field is CSL, headquartered in Melbourne, with an operational network across the United States. Australia has established a system called PBS, Pharmaceutical Benefit Scheme, under which pharmaceutical companies must negotiate prices with the government before being allowed to sell drugs to the public. Thanks to this, a medication might only cost a few $dozen in Sydney, while people in New York have to pay 5 to 10 times more for the same active ingredient. This has long made PBS a particular concern in the eyes of American pharmaceutical corporations, which want to freely price drugs globally. And now, under the new tax policy, many believe that PBS is being put on the chopping block if Australia wants to maintain its export position to the US. But despite that pressure, the Australian government has not backed down. Currently, Australia is still waiting for more detailed information on how these new tax rates will be applied. But while many American pharmaceutical corporations criticize Australia's subsidized drug policy, the Australian government has made it clear the pharmaceutical benefit scheme will not be up for negotiation. This is not just a political statement, it is an affirmation of a healthcare model that Australians have preserved through many generations, where profit cannot stand above public health. The question arises, will upholding principles cause Australia to be sidelined from the world's largest trade chessboard? Or is this a test of whether a country can uphold its principles while still protecting its economic interest in this game? Australia has chosen to sit up straight. Unlike Australia, where the government openly opposed and the media reported extensively, Canada chose a completely different strategy: silence but not passivity. As of early July, Canada had not yet received a tax warning letter from the White House, but experts understood it was only a temporary silence, because Canada's pharmaceutical system is more closely linked to the US than any other country. According to MedTech Canada and the University of Toronto, Canada's drug supply chain can cross the US border 2 to 3 times before reaching the patient. That means just one tax from Washington could disrupt the entire supply chain. Additionally, about 80–90% of the raw materials for pharmaceuticals in Canada originate from China and India, places where the US is also imposing heavy tariffs in such a fragile and cross-border network. A 200% tax is not just a number, but a comprehensive shock to the entire healthcare system. But instead of reacting with words, Canada chose to take action. Health Canada has compiled a list of essential medicines to prepare for a shortage scenario. Expert groups quietly sent data to Washington officials, arguing on humanitarian grounds rather than commercial ones. In addition, medical associations and businesses are lobbying for exemptions based on cooperation in public healthcare rather than political exchanges. While the American media is busy monitoring hardline statements in Ottawa, they are building a medical firewall quietly but steadily. The highlight of Canada's strategy is its unusual calmness. Their Prime Minister was once the Governor of the Bank of England, and Canada understands that in a time-constrained chess game, the one who can hold their breath longer will be the last one standing. At the Calgary Stampede event, he did not talk about negotiations. Instead, he called on the people to focus on internal strengths, such as clean energy, domestic production, healthcare security, and housing. Instead of confrontation, he chose to pivot. This is perhaps a necessary strategic retreat to pull the opponent out of a short-term offensive, and the market seems to understand that TSX and S&P 500 both rose as investors believe that Canada is choosing a more stable path. But some are also asking, is this silence a tactic or impotence? If Canada continues to stand firm, how will the US respond next? The answer is still unclear, but in a world where everyone tries to shout loudly to prove their strength, sometimes keeping silent is what makes the biggest impact. In the world of trade, tariffs can be a lever, a tool for negotiation, redistributing benefits, or promoting domestic production with steel, with cars, with electronic chips. Those things are sometimes necessary in the context of global competition. But pharmaceuticals are not like interchangeable products, because behind every pill, it is not just a number in the import-export table, but a person waiting for treatment, a patient hoping to be saved when the tax rate is raised to 200%. What is affected is not just the revenue of a manufacturing plant, but rather the cost of hospital treatment, community health budgets, and the burden on the shoulders of the elderly, low-income, individuals or families with young children undergoing chronic treatment. For many elderly people in the US or Canada, accessing medication is already a challenging journey. Just a small change in price is enough to force them to choose between a prescription and a meal at the end of the month. And now those changes may no longer come from the market, but from coercive trade letters between countries. If car prices go up, we can postpone the purchase. But if the price of medicine increases, who can delay illness? The question is not whether the negotiation strategy is right or wrong, but rather should trade, no matter how important, cross the boundaries of medical ethics. At a time when the world is still recovering from the pandemic, when people are just learning to trust the healthcare system again, even temporary tax shocks on pharmaceuticals can leave a lasting scar in the hearts of the people. Each country has the right to protect its own interests, but in the field related to life and hope, perhaps what needs to be protected first is not profit, but trust. There are relationships that are not measured by trade volume, but built on history, on spilled blood, on standing together in the most difficult moments. For decades, the United States has been at the center of that network, a pillar, a big friend that nations believed they could rely on. But when the tariff letters are sent indiscriminately to both competitors and strategic allies, perhaps something has changed. Not everyone reacts with words, but in closed-door meetings, at defense analysis tables, and in unpublished memos, trust is being called into question. Should a strategic partner treat an ally like a negotiator? The signals from the market have reflected that fluctuation. When Japan and South Korea received letters threatening a 25% tax on all exported goods, not only did the stocks of major corporations like Toyota and Honda decline, but trust, which is the most invisible yet valuable thing in international relations, is also shaken. A South Korean commentator said, "We used to think the US was our protector, but now that policy makes us feel like our loyalty is being tested." In Japan, where national pride is carefully preserved, being treated like a straightforward tax object has caused quite a few citizens to express confusion. And that is something that cannot be quantified, in money cannot be compensated with discounts or aid packages, because once trust has been broken, it is very difficult to fully mend it. In the current context, the feeling among allies that they are no longer prioritized can create unintended consequences. No one opposes a country's right to protect domestic production. But when trade letters are written without accompanying dialogue, the first thing lost is not the contract, but the companionship. The policy of negotiating through pressure may be effective for some industrial goods, but when it is applied indiscriminately, even with countries that have gone through many historical chapters with the US, the effect is not just short-term, but rather the slow yet concerning shift of trust. And the question arises, can a superpower continue to maintain its leading position if its close partners gradually feel they are just numbers on the scales of benefit? If the same tax policy is a storm, then each country is reacting in very different ways, and it is precisely in those differences that one can see the bigger picture about how the world understands America, fears America, respects America, or begins to learn how to avoid dependence on it. Australia chose to respond strongly. They do not accept giving up the PBS program, a symbol of the country's humanitarian healthcare model, in exchange for a spot on the tax-exempt list. For many Australians, this is a decision to be proud of. One leader stated outright, "The price of medicine cannot be adjusted by external pressure, but the accompanying cost is not small." As of now, Australia has not yet received any official invitation to negotiate from the United States, and if the tax is applied on time, billions of dollars in export value could be affected. However, in the eyes of many Australians, this is not just a trade issue, but a choice between principle and concession, and they chose to uphold their core values. Canada, on the other hand, has hardly made any public statements, but no one can say they are standing still. From medical lobby groups to government experts, everyone is quietly taking action, creating a list of essential medicines, increasing reserves, sending reports to partners in the US, and especially a very different strategy: no public concessions, but also no confrontation. And it is precisely that calmness that makes many Canadians feel more at ease in a constantly changing world. Sometimes maintaining a firm stance without causing a stir is the way to make the people see the maturity of their government. As for Japan and South Korea, they are in a more difficult position. They are countries with deep ties to the US economy, but they also have a strong sense of pride and high expectations from their citizens, caught between trade pressure from Washington and domestic public opinion. They chose a somewhat neutral response, not reacting too strongly to avoid escalating tensions. But they also did not rush to sign to maintain national dignity. It can be said that Japan and South Korea are in a waiting position where every step must be carefully calculated, because a too rigid response could harm the economy. But an overly easy concession will make the domestic population question the leadership's role. Each response has its own reason, and behind it are national stories more complex than any tweet could capture. What is the meaning of camaraderie among allies if they only stand by each other when there is no pressure? And finally, what makes an alliance sustainable? Trade commitments or mutual respect when there are no clear benefits? In every international negotiation, people often mention numbers: total trade volume, tax percentages, GDP growth. But there is one thing that few people talk about, which is how the lives of ordinary people will change when a policy is signed from afar, with the plan to impose a tax of up to 200% on imported pharmaceuticals. The first to be affected are not the markets, but the wallets and health of ordinary people. Those who do not appear in the news, do not have spokespersons, and do not have the right to choose the timing of negotiations. Imagine a 74-year-old man living in Ohio being treated for chronic heart disease. He takes 3 types of medication each day, 2 of which are produced in Canada, and 1 from a company based in Australia. On average, he has to pay $20 for all 3 types each month. But if the tax policy is implemented without exemptions, that number could double or even triple. A study by the Kaiser Family Foundation shows that nearly 29% of Americans over 60 have not purchased their medication as prescribed simply because the price was too high. For many people, the high cost of medication not only makes them reconsider, but also directly leads to mistreatments, hospitalizations, or worse, the loss of any chance of recovery. Medicine is not merely a product. It seems to be the result of an entire global value chain. A cancer treatment drug produced in Canada may use ingredients from India, be packaged in the USA, and then shipped back to Canada for distribution to border states. When a 200% tax is imposed on this supply chain, not only do costs increase, but the circulation time is also disrupted. What does that mean? Hospitals are forced to change providers. Insurance companies are recalculating their reimbursement packages, and consumers who are already accustomed to waiting for a stable prescription or choosing a less effective medication. In the medical world, a week's delay can mean the difference between recovery and no longer having anything. Tax policies do not discriminate by age or income, but their impact falls hardest on the most vulnerable groups, the elderly, low-income individuals, and families with long-term care patients. According to data from AARP, the American Association of Retired Persons, 80% of people over 65 in the US use at least one prescription medication each day. Nearly 40% of them use 5 or more types. Just a zero increase for each type could total over $00 a month for many. That's the difference between an electricity bill and a prescription. Many people believe that because Canada is a drug exporting country, it is less affected. But in reality, Canada imports up to 90% of its pharmaceutical raw materials from other countries, especially China and India, where the US is also imposing strict trade tariffs. This makes Canada vulnerable, and if the global supply chain tightens, the prices of medicines in Canada will also be affected in a chain reaction. And that is why Health Canada has started to build a list of drugs that need to be protected, stocked, and prioritized, not out of fear, but because they know the public cannot wait for politics to reach an agreement. In border states like Vermont or Michigan, thousands of Americans regularly drive to Canada to buy medication where the prices are much lower. According to 2023 statistics, more than 2 million Americans have purchased medication across the Canadian border. If the new tariffs force Canadian manufacturers to raise prices or limit exports, those quiet journeys will have to come to an end, and thousands of people will have no alternative. A woman in Buffalo once shared, "I didn't go to Canada to save money. I went there to be able to live." There is no tax policy that is absolutely good or bad. But when trade policies begin to encroach upon the healthcare sector, the people, especially the elderly, may feel abandoned in decisions made from afar. They do not participate in negotiations. They are not aware of the progress, and they only know that the price of the medicine they are using may no longer remain the same. Trust in the healthcare system does not only come from doctors, but also from feeling protected even when the global situation changes. The question is not whether to protect domestic production or not, but rather, how can we ensure that the people do not bear the entire cost of a global trade decision in each pill? There may not be a label saying made in Canada or made in the USA, but for consumers, the most important thing is, does it arrive on time? Is it still affordable? And is there anyone really thinking about them amidst the bargaining at the negotiation table? When we look back at the global picture, a big question still hangs in the air. Can trade policies, even if economically effective, inadvertently harm the most vulnerable? We cannot deny that economic growth and the protection of domestic production are important factors for each country. But when this policy touches the field of health, where life and death are decided by distant political decisions, is there anyone who truly wins in this battle? Of the elderly, those who have few choices, the families facing illness, they are not just numbers in a statistic. They are real people with names, with stories, with fears when facing an uncertain future regarding the possibility of continuing treatment. And their stories will not end on the pages of trade agreements. If medicines become a luxury, are we truly still living in a fair society? All we can do is ask questions and open a dialogue, because when faced with policies that can change the lives of millions, We cannot just stand by and watch. We need to think more deeply about the long-term consequences and especially always remember that every major decision has small but profound impacts on each individual. We want to hear your thoughts. What do you think about using tariffs to address the issue of drug production? Is this policy truly effective for the people, or does it only increase the difficulties for those who are already facing many challenges? Share your opinion in the comments section below. We want to emphasize that this video is created for formational and educational purposes, not to attack any government or individual. The viewpoints in the video reflect publicly available information, and our goal is to create an open dialogue where viewers can collectively think about the impact of policies and share their perspectives. If you find this content useful, don't forget to like, share, and subscribe to the channel to follow the next videos. We will continue to bring deep topics and useful information to help you better understand the world around you.